nclexrn Practice Flashcard 2026 was to strengthen key concepts quickly. Question 1. A patient is about to undergo bone marrow aspiration and expresses fear. Which is the most effective nursing response? Option A. Warn the patient to stay very still. Option B. Encourage the family to stay in the room. Option C. Stay with the patient and focus on slow, deep breathing for relaxation. Option D. Delay the procedure. The correct answer is option C. Stay with the patient and focus on slow, deep breathing for relaxation. Guided relaxation and a calming presence are effective ways to manage procedural anxiety and help the patient remain still during an invasive procedure. Question 2. A mother is concerned her 2.5-year-old son is not yet toilet trained for urine. Which statement by the nurse is correct? Option A. The child should have been trained by age 2. Option B. Bladder control is usually achieved before bowel control. Option C. Bowel control is usually achieved before bladder control. Option D. The child should be told no each time he wets. The correct answer is option C. Bowel control is usually achieved before bladder control. Developmentally, children typically achieve bowel control before bladder control. Physiologic readiness for toilet training usually occurs between 24 and 36 months. Question 3. A 14-month-old child will not fall asleep without a bottle of milk. Which instruction by the nurse is correct? Option A. Allow the child to have the bottle at bedtime. Option B. Put juice in the bottle instead of milk. Option C. Give only a bottle of water at bedtime. Option D. Do not allow bottles in the crib. The correct answer is option D. Do not allow bottles in the crib. Bottles in the crib at night are the primary cause of early childhood caries, bottle rot, and increase the risk of choking and ear infections. Question 4. Which of the following actions is not appropriate in the care of a 2-month-old infant? Option A. Place the infant on her back for naps. Option B. Allow the infant to cry for 5 minutes before responding. Option C. Talk to the infant frequently and make eye contact. Option D. Wait until at least 4 months to add cereals to the diet. The correct answer is option B. Allow the infant to cry for 5 minutes before responding. At 2 months, infants are in the trust versus mistrust stage and lack the ability to self-soothe. They require prompt responsiveness to build security. Question 5. Which of the following suggestions would be helpful to prevent constipation in an older patient? Option A. Moderate exercise for 30 minutes each day. Option B. Drink 6 to 8 glasses of water each day. Option C. Eat a diet high in fiber. Option D. All of the above. The correct answer is option D. All of the above. The combination of physical activity, adequate hydration, and high dietary fiber is the gold standard for preventing and treating constipation non-pharmacologically. Question 6. A child has suspected rheumatic fever. Which of the following observations is not confirming the diagnosis? Option A. A reddened rash over the trunk. Option B. A history of sore throat in the past month. Option C. A negative anti-streptolicin (ASO) titer. Option D. An unexplained fever. The correct answer is option C. A negative anti-streptolicin (ASO) titer. A positive ASO titer is required to confirm a recent streptococcal infection, which is the necessary precursor for a diagnosis of rheumatic fever. Question 7. A nurse notes a moderate amount of serous drainage on a surgical dressing 24 hours after surgery. Which of the following is the appropriate nursing action? Option A. Notify the surgeon about infection immediately. Option B. Leave the dressing intact. Option C. Remove the dressing and leave the wound open to air. Option D. Change the dressing and document the clean appearance of the wound. The correct answer is option D. Change the dressing and document the clean appearance of the wound. Serous drainage, clear/yellowish, is normal 24 hours post-op. The nurse should change the dressing to maintain hygiene and inspect the site. Question 8. Which patient complaint regarding a new fiberglass cast on the right radius would cause the nurse to be most concerned about impaired perfusion? Option A. Severe itching under the cast. Option B. Severe pain in the right shoulder. Option C. Severe pain in the right lower arm. Option D. Increased warmth in the fingers. The correct answer is option C. Severe pain in the right lower arm. Unrelieved, severe pain in the affected limb is an early sign of compartment syndrome and impaired tissue perfusion. Question 9. An older patient with osteoarthritis is preparing for discharge. Which of the following information is correct? Option A. Daily exercise helps decrease discomfort. Option B. Joint pain will diminish after a full night of rest. Option C. NSAIDs should be taken on an empty stomach. Option D. Tylenol is a more effective anti-inflammatory than Motrin. The correct answer is option B. Joint pain will diminish after a full night of rest. Osteoarthritis pain is typically characterized by wear and tear. The pain increases with activity and is relieved by rest.